Today, there are three main types of treatment to fight cancer: surgery, chemotherapy, and radiotherapy. Unlike traditional radiotherapy that uses photons to irradiate and kill tumor cells, proton therapy is an advanced form of treatment using protons. These particles give proton therapy its many advantages. Proton therapy's greatest advantage over conventional radiation therapy is its accuracy and its ability to spare healthy tissues. Conventional X-rays are made of photons that pass through the body and deposit considerable energy before and after the tumor. Protons, however, have a particular physical property called the Bragg peak. They're able to deposit less energy on their way to the tumor and do not affect tissues beyond it. This property allows to confine the radiation dose to the tumor and radically decreases the risk of injury to surrounding healthy tissues. The proton originates from the iron source, where hydrogen atoms are separated into electrons and protons. The protons are injected into the cyclotron, where they're accelerated. Then, these high-power protons are sent through an energy selection system and a degrader that adjust their energy. The beam transport system conducts the protons with the right energy and trajectory. Then the proton beam arrives in the treatment room via a gantry. The gantry revolves 360 degrees around the patient so that the beam can be delivered at any angle. A high accuracy of patient positioning is required. IBA's treatment rooms are equipped with the latest patient positioners, alignment, and imaging systems to ensure the reproducibility of patient positioning. Today, proton therapy patients have access to a state-of-the-art delivery mode called pencil beam scanning. The beam is steered across the target volume one layer at a time, pixel by pixel, to precisely match the shape of the tumor. With this active scanning technique, the physicians are able to change the proton dose at any specific location in the target. This allows proton therapy to adapt to very complex shaped or moving tumors, improves the dose conformity, and reduces the integral dose of radiation given to the patient. Proton therapy is changing the way you treat cancer.
Linac is an exciting new treatment device, a radiation therapy treatment device that actually combines a modern, fully functional MR scanner with a modern, fully functional linear accelerator to tailor therapy in a much more precise way for individuals with many different types of tumors. We'll be able to see some tumors that we can't see with the CT scanner, like pancreas tumors, tumors in the liver, kidney tumors, tumors that move as patients will breathe over the course of treatment. And we have to be able to lock onto that tumor, follow that motion, and continue to treat it in a conformal way. And the MR Linac allows us to do that in ways that we've not really been able to do with any other device. One of the exciting parts of the MR Linac and just MR-based treatment planning in general is the ability to use not just the anatomy information from the MRs, but also understanding where the active parts of the tumor are. It allows us to not only personalize treatment towards the tumor, but towards the surrounding normal tissue. And so the first gains are going to be decrease in acute toxicity or toxicity that you experience during the treatment. And ultimately that should lead to less long-term side effects as well.
Brachytherapy is a cancer treatment where radioactive material is placed near the cancer. Depending on your procedure, radioactive wires, ribbons, or pellets called seeds are placed directly into or near your cancer tumor. The radiation from the brachytherapy kills cancer cells by inflicting overwhelming damage to their DNA. The tumor shrinks as the cells stop dividing and die. The two main types of brachytherapy are temporary and permanent. If you have temporary brachytherapy, your doctor will insert a delivery device, such as a bronchoscope, to get as close to the cancer as possible. Temporary brachytherapy is usually a high-dose source of radioactive material that will treat your cancer for several minutes. Once the treatment time is over, the radiation source will be removed. If you have permanent brachytherapy, your doctor will implant radioactive seeds that will stay in your body and emit a low dose of continuous radiation. The seeds will get weaker over time and gradually stop emitting radiation. Brachytherapy may be used along with external beam radiation therapy or other cancer treatments.